Hi everyone, welcome to the webinar, No Excuses, Filling the Evidence Gap on Social Assistance in Humanitarian Settings. This webinar is organized by the International Policy Center for Inclusive Growth in partnership with UNICEF. Today we have a great panel with us, Sarah Hague, Chief of Social Policy at UNICEF Lebanon, Benjamin Schwab, he's a development economist at Kansas State University, and James Omolo, he's a cash transfer and social protection expert at FAO Sub-Regional Office in West Africa and Sahel. My name is Raquel Tebaldi. I'm a researcher at the International Policy Center for Inclusive Growth, and I'll be the moderator of today's webinar. So I'll begin by presenting, giving a little bit of background on the presenters today. Sarah is the Chief of Social Policy at UNICEF Lebanon, where she leads a team working on child poverty and social protection and public finance. She has also previously worked for UNICEF in Ghana and Burkina Faso, as well as for Save the Children UK, the World Bank, the government of Rwanda, and the NGO Stamp Out Poverty. Dr. Benjamin Schwab is a development and health economist at the Department of Agricultural Economics at Kansas State University, and he has also worked with IPC and collaborated on several large-scale impact evaluations. His current areas of research include a variety of topics related to food security, agriculture, and rural poverty. James Omolo is a cash transfer and social protection expert working to support the capacity enhancement and coordination of social protection and cash transfer activities at FAO. He has also previously worked in Northeast Syria with the Norwegian Refugee Council, supporting its shelter sector in remote cash transfer activities. While I'm a researcher here at the IPC, we're focusing on social protection. And today I'll be moderating the event, so I'd like to remind everyone who is joining us to submit your questions to the panelists. You can do so at any time. Simply type them at the chat in the chat bar that you see on your webinar application. We'll be reviewing the questions as they come in, and at the end of the webinar, we'll have a session where they will be addressed to the panelists, and you'll get a chance to hear their answers. So without further delay, I invite Sarah, our first presenter, and hand it over to her.
Thank you very much, Raquel, and good morning and good afternoon, everybody. Again, as Raquel said, this webinar was organized with an aim of filling a bit of a gap in the evidence on humanitarian social assistance programs, and that's exactly what we've been doing in Lebanon. I arrived here just over a year ago when we were already well into this work on producing the impact evaluation of our social assistance program for refugees here in the country. It's called Manila, and I'm going to share a little bit some of the context and the results with you. So if we can go to the next slide. So I'll go briefly through the context that's relevant here in Lebanon, just a few key points, and then explain a little bit what is this program, Manila, and then focus on the impact evaluation, so how we carried it out, and of course, what the results are. But most importantly then, I want to look briefly at what's next. What do we do with this impact evaluation, and how does it shape our programming as we go forward? Next. So very briefly, before we start, I just wanted to show you this woman and her family. She actually features on the cover of the impact evaluation report that we produced. Her name is Jazeera, and she lives in a suburb of Beirut here in Lebanon. You can see her there with her 4 children. And the point is simply that she faces a whole range of different challenges and different barriers in her life, and her children equally face a number of different deprivations in health, education, food security, employment, and so on. Her issues go way beyond just one simple sector. So for UNICEF, we really want to see how we can address these multiple deprivations through social assistance going beyond cash. Next. So very briefly, in terms of the context, some of you may be familiar with the situation here in Lebanon, but of course we're influenced very much by the global situation of this increasing use of cash transfers in humanitarian context, particularly since the Grand Bargain Agreement. And that means both there's been an increase in sort of what I call genuine social assistance programs providing cash, but also those programs which are simply monetized programs, where programs used to be provided in kind and since have been substituted with cash in place of the in-kind provision. So we've been assuming, I think, in many contexts for many years that because cash transfers and social assistance have had positive impacts in development contexts, that we assume that they have the same positive impacts in humanitarian contexts. That might be the case, but of course these situations face very, very different challenges, and I think it's important to really look at the evidence in humanitarian situations, which of course also vary substantially from country to country. Here in Lebanon, as many of you will know, we have the highest refugee to citizen ratio in the world. Many people have been here since the beginning of the Syrian crisis, or of course since before. This means that people have been living in the country for 5, 6, 7, even 8 years. They've been spending their assets that they have brought with them. They've been using up the money and assets that they brought with them from Syria. Households now have very high levels of debt, around $1,000 on average per household. And we're finding that refugee households are now increasingly using negative coping strategies, as we call them in UNICEF, such as having to take children out of school, probably sending them to work, perhaps marrying the girls off when they're still very young. What's also important to highlight is that for UNICEF in Lebanon, we also now are supporting the national system. So we provide the technical support alongside, of course, other key donors such as the World Bank and the EU and many others, to support the national government to think about how they can develop a national system of social protection. Because despite the fact that Lebanon is an upper middle income country, it still does not have really a national social protection system. And it's important to highlight that politically, there is no way really to integrate refugees into any kind of national social assistance programs. So programs for refugees continue to run alongside the national system in parallel. Next. So in terms of what UNICEF Lebanon has been doing, as I said, we focus going beyond cash, thinking about child-focused social assistance. What does this mean? Well, essentially, as in the case of Jazeera, that woman that you saw at the beginning and her family, we're trying to construct programs which can tackle multiple deprivations at the same time, can hopefully address some of these negative coping strategies that I mentioned, such as sending children out to work, and can preferably have a focus more on the medium to long term. So not just, for example, putting food on the table for the day or for the week, but helping the family to be better prepared for the long term through improving their well-being, such as helping children to stay in school, for example. We also want to explore how our programming can be integrated. This means not just linking social assistance or cash programs to another program, but genuinely seeing how we can integrate social assistance with other sectors and other sector programs. And I can talk a little bit more about that later or in the questions if you like. We also want to take more of a systems approach. So I just said that in Lebanon, politically, it's not possible to integrate refugees into the national system. However, there are ways to connect the two. And there are ways to see how we can plan for the future. As funding starts to decline, we need to think about how the government of Lebanon is going to cope with the situation that it continues to find itself in. The final point on the context is just to say that here in Lebanon, we have a particularly interesting situation where with UNHCR and WFP, we are leading the implementation of a joint cash delivery system. It's not a joint cash program, but it's a common system for actually delivering the cash to refugees. And it's been reviewed in a global report put together by PwC and the Better Than Cash Alliance that was produced at the end of last year. And I think it's now being used as a good example for how agencies across the UN and beyond can program and deliver cash in a joint way to refugees in humanitarian contexts. Next. So one slide very briefly on the program itself. It was called Manila. Again, it's a child-focused social assistance program. It was aimed at improving child well-being, but it was particularly linked to the education sector. So it's about addressing costs, opportunity costs of sending your child to school, and also reducing some of these negative coping strategies that I talked about. It provided unconditional cash transfers. So younger children were receiving $20 per month. Older children received an additional $45 per month because older children are, of course, more likely to find it harder to go to school because they need to perhaps go out for work. And they received a payment every month throughout the school year, throughout the academic year, meaning that they received about 8 payments per year. And again, those payments were provided on these joint cards, these common cards, so a single card that was providing all of the payments from different agencies, for which the acronym is LOUISE. The program also included a multi-sector referral mechanism for all household members. So households that were most at risk or were found to be taking children out of school, they would receive household visits. And then any issues that those household members were experiencing, be it in health and food security and so on, they could receive the benefit of some form of referral to other services which were in the region and accessible for those families. And those household visits were found to be particularly important in keeping children in school and encouraging them to return when they stopped going. It reached almost 50,000 children across the country in 3 governorates of the country. Those are mostly Syrian children who were enrolled in second shift schools. This is the name of the shift of schooling that the Syrian children go to after the morning shift for Lebanese children has concluded. And it was implemented by UNICEF, but also in collaboration with WFP and also with the Ministry of Education here in Lebanon. And I'm talking about it in the past tense because this program has now closed. It ran from 2016 to 2018. And by the middle of next year, the funding situation was such that we were unable to continue it. Next. So looking now at the design of the impact evaluation itself. So the impact evaluation was carried out by 2 agencies, by UNICEF's Office of Research in Ochenti, and by the American Institute for Research in the US. And they used a non-experimental longitudinal design, which essentially means that we had a very large sample size of both treatment and control. And it was based on a geographical regression discontinuity design, which meant that we were able to look at a treatment group that were, of course, receiving the program, and then a very similar control group who were just over the border in other areas of the country that were not receiving the program. So it means that we were able to accurately attribute the results that we found to the program itself. So of course it was both quantitative with a baseline and a midline and an end line over a period of time, and you can see the time frame there at the bottom of the slide. But it also used qualitative data, key informant interviews and focus groups, of course. And again, it was multi-sectoral. So this is what's important about the types of program that we've been implementing, is we're not just looking at one particular sector. We're seeing how social assistance impacts on a range of different sectors. So you can see we did the baseline, of course, just before the program started. The midline was done just a few months later in early 2017. And then the end line was done just a few months after that, at the beginning of the school year in 2017. So it's just over a year time frame. Next. In terms of the results, I've got 3 slides on the results, both sort of the good, the bad, and the not so clear. So in terms of the positive results, there are a range of things across all of these different sectors that I was talking about. We could see, for example, that households were spending more on their children. They were spending more on both health and education, which is, of course, positive. But in terms of healthcare, we saw that for younger children, even in the relatively short time frame of just a year of the impact evaluation, we found that younger children were actually healthier. They were about 10% healthier than the non-program supported children. We also found that children were less likely to be working in the home. So in the qualitative discussions, people would tell us, we're not sending our children out to work anymore, they're going to school. But in the quantitative, when we did the survey, we found that people were telling us more about the chores that children were doing in the home. And there was a significant reduction in the amount of housework, caring for other individuals in the home that children were requested to do. And this essentially meant that they have more time for education, so it was a positive thing. There were some results around what we might call mental health, which were quite unclear. We found that in relation to optimism, children became more optimistic, but I don't know if that means that we can say they had better mental health. I think it's more complicated than that. In relation to food security, there were some very positive findings as well in relation to food security. Children were much less likely to go to bed hungry at the end of the day, much less likely to skip a meal. They were much more likely to eat breakfast in the morning. For example, the children who were not receiving the program would have breakfast about half of the time. About 50% of children were having breakfast before they went to school. Whereas the program children, the Manila program, were having breakfast about 70% of the time. So that's quite a big jump from 50 to 70%. And of course, we can all imagine the impacts of having a good breakfast before you go to school on concentration and productivity and learning and so on. In relation to education, I said that households were spending more on education, but we found that many months into the school year, when children who were not in the program had started to drop out occasionally, they weren't coming every day, we found that in comparison, the Manila program were attending much more. They were attending about 20% more time in school than the non-Manila program. So I think this is an important finding as well. Next. In terms of the qualitative as well, we had, as I said, this qualitative analysis, which we got some interesting findings from, which I mentioned in the report, which we tried to interpret alongside the quantitative. We had teachers saying that we felt like the children are really living like other children now, or a girl saying that because we're not required to do so much work in the home, we have more time to study, there's more focus on our education. And the quote that I particularly like is that one on the bottom left there, where a teacher said that he now feels that the child feels that they're now equal to other children. And I think there's been a lot of discussion recently in the evidence around social assistance about the impacts on dignity and the impacts on shame that individuals feel from receiving or not receiving social assistance. So I think this is quite an interesting finding, that people were saying that because they're receiving the program, they feel more equal to their peers who are otherwise not supported. Next. But as I said, not all of the impacts were clearly positive, and it raised a lot of questions for us. There was no impact on child labor. So this is, children actually going out to work, going out and doing economic activities. Now, this was because in the quantitative, when we did the survey and we asked people, are the children working in your household? The answer was no. So if something is already very low, you cannot reduce it. You cannot have an impact on reducing it. So there were no impacts that were observed there. Whereas in the qualitative, people did report that children are not going out to work very much. So was it something to do with the way the quantitative questions were asked and the fact that people did not want to report directly on the fact they were sending their children out to work? We don't know. Child marriage was an issue that this program had initially wanted to address, and the impact evaluation had talked about addressing it, but it was not something that in the end that was included in the design. Probably because child marriage is something which is impacted by so many different factors over a much longer period of time, it wasn't deemed possible to address. I said that the health of younger children improved, but the health for older children didn't change, which perhaps over a year is not surprising. And the amount of time that younger children were working in the home also didn't change. For me, this isn't surprising, because a 7-year-old or an 8-year-old is probably not doing so much work in the home anyway. It's much more relevant for an older child, 14-year-old, for example. In terms of those other indicators on mental health, we found no impact on self-esteem, on social support. And a key issue for us was that in the Manila program, we used the school as the entry point. Those children who were enrolled in school, enrolled in the second shift schools, those were the ones who were enrolled into the program. Meaning, of course, you cannot really have a significant impact on enrollment itself if you are enrolling children into the program who are already enrolled in school, if you follow me. We also found that a lot of the schools, around 50% of the schools in the program areas, already were full by the time the program was getting off the ground. So again, it's not possible to increase enrollment if the schools were already full. And lastly, we did the end-line impact evaluation just at the beginning of the school year. So there was no impact on attendance in class at the beginning of the school year. We found that as the school year began, whether the child was in the Manila program or not, they were all in school, and they were in school on a regular basis. It was only much later on in the year when children started to drop out that we really saw this important impact of the Manila program keeping the children in school. Next. So lastly, before I conclude, I wanted to share a few challenges that we've faced. There were several challenges. I don't think these are presented in any particular order. The one challenge was that the impact evaluation was done just over a year's time frame. I don't know whether 1 year is really enough to capture the impacts of the program, and of course we don't know whether those impacts were then sustained beyond that time frame. We had this issue with the timing of the end line. As I just mentioned, the end line was carried out at the beginning of the school year when all children were attending school, so we couldn't really see any impacts of the program on attendance at that point. And this issue of the supply side is really important. The schools were provided, of course, by the government. These are government schools that are implemented by the Ministry of Education. UNICEF does not control the supply of education in that sense. So when the schools reached capacity, there was nothing in that case that UNICEF could do about it. So we really need to bear that in mind and think about the supply side of our social assistance programs and the response that can be created by them. So systems, national systems are crucial. We could have used the qualitative data much, much better and really tried to make this a mixed method impact evaluation. And of course, we know that this is very, very difficult to integrate both qualitative and quantitative data. And we found no impacts in relation to gender, no differential impacts, meaning that both boys and girls were equally as likely to benefit from the Manila program. This might be because, this might be a positive thing, because the program was able to benefit girls equally as it did boys, or maybe it means we were missing something, that girls were more disadvantaged and perhaps they should have benefited more. And it's not something that we looked at following the impact evaluation. So we need to think about it going forward. Next. This issue of child labor, I mentioned we need to think about that more. How do you ask people questions about an issue that they know they shouldn't be reporting? And the challenge, of course, that I mentioned of continuing the program was that we didn't have multi-year funding. Social protection or social assistance is by definition multi-year. It should be predictable. It should be something you can guarantee to people that a program will keep going and that they can rely on it and depend on it. But the context of the situation here in Lebanon and in many humanitarian contexts is that you simply cannot expect multi-year funding, and that really jeopardized the program and ultimately brought it to an end after 2 years. But of course, as funding reduces for humanitarian situations across the world, we cannot expect in many countries, not all, but we cannot expect in many countries that a national system is willing or able to simply pick up the humanitarian need and be able to integrate refugees into a national system, which here in Lebanon is not possible. And lastly, my final point on the challenges is that we need very well-designed impact evaluations. This was a good impact evaluation. It was excellent quality, but it cost us $500,000. So we really need to think about how we use our resources and to make sure that when we produce this evidence, we use it, hence why we're sharing it with all of you, and think about how it shapes our programming for the future. So my last slide, if we can go to the next slide, is just to share a little bit of thinking about what's next. So we found these very positive impacts from the program. We need to learn on them based on the current context of reduced funding and think about the future. So for us, the future means starting a new program, but building on Manila very much, building on the design and the delivery and the learning of that program, but with a reduced funding context. So what we want to do is design a program which is truly integrated. So at the same time that children are going to be receiving social assistance, they will also be receiving the education programming that they need. They will also be receiving the child protection programming that they need. They may also be able to access other programs in other sectors. And of course, if we do have reduced funding, we need to think about how we reach the most vulnerable. So we have mapped out vulnerability in terms of geography in Lebanon, so we can target programming to the very poorest areas, but also reaching those children who are completely excluded from school and from learning, and seeing how we can really reach those children. And the last point there is that for the joint cash delivery system that we have here in Lebanon, which is being sort of quite talked about globally, we need to make sure that we document this experience. We're actually doing it right now and learning from it so that other countries can hopefully build on that experience and move in a similar direction. So I will leave it there. Thank you very much.
Thank you very much, Sarah, for your presentation. So now from the case of Lebanon, we're moving to the case of Yemen, and we're making Benjamin the presenter. Benjamin, over to you. And I'd just like to remind everyone who has joined since the start of the webinar that you can send us your questions at any time. At the end of the webinar, we'll have a Q&A session with our presenters, and even if you cannot stay until the end of the webinar, you can catch the recording, which will be available on YouTube, and we'll share with everybody who registered. So Ben, over to you.
Sorry about that. Thank you, everyone. And thank you to Sarah. What I'm going to be talking about today is a program from Yemen, an impact evaluation program from Yemen. And many of the themes that I'm going to discuss, Sarah also discussed with respect to the transfer program in Lebanon. In particular, the uniqueness of humanitarian settings and the multiple constraints that populations in humanitarian settings face, and in particular, the role of future expectations and risk, and just thinking about the future, how that plays a part in how we expect to see impacts from those transfers. So, and if there's any problems with my screen, I'm going to expect the organizers will let me know, but hopefully everything is going okay. Okay, so before I start, I want to say that this is a program from Yemen, and it was one that was evaluation of a program that was implemented by the World Food Program, and the funding came from the Spanish government, so I want to thank them for the evaluation funding. And you can see from the title that we're talking about a crisis setting. This is actually a time before the current civil war and current crisis going on in Yemen. So this is just prior to the outbreak of the civil war in 2012. When I'm going to use the term crisis, I'm going to be talking about that as distinct from a situation of persistent poverty where we have an acute need, something that's slightly different. So the questions that we're going to be asking here is, do we actually have any measurable productive impacts from the food and cash transfer program? And we're dealing with rural beneficiaries. We're dealing with a country that was on the brink of severe economic and political turmoil, so there was a lot of uncertainty about what would happen. And we're also going to be able, because of the way this program was designed, to be able to look at the to distinguish between the types of impacts that we find depending on whether the transfer is given in cash or in kind, so with food. So I'm going to give you just a preview of the results. So in case you need to run, here's what we find. What we're going to see is we're going to see some modest increase in some of these indicators of productive investment. Your definition of modest and how you think about these results is probably going to depend on what your expectations of how much a transfer program can increase productive investments among beneficiaries. If you have very low expectations for such a program, you might be surprised by what we find. If you had very high expectations, you might be slightly disappointed. Food recipients, what we find is in particular is that food recipients, they actually initiate cash cropping at higher rates than cash recipients. And we'll talk about some of the economic theory as to why that might be the case. Cash recipients, they're going to actually invest in some more investments that require some liquidity, like livestock. And so what we're going to find overall is that we can alleviate poverty and support food consumption in these crisis settings, and doing that can increase the productive capacity of the households. But the type of productive investments that we're going to see might depend on what kind of assistance is provided. All right, so why are we asking some of these questions? Well, one of them is because even though we've had a lot of research on social protection programs and transfer programs, and we have a lot of agreement on the value of these programs for social protection and consumption, the debate over whether these types of programs have long-term impacts on productive investments, whether these impacts that we see on consumption are sustained over the long term, that debate has really increased sharply in recent years. And there's conflicting evidence. We see in general that nutritional programs, measures of child consumption really seem to increase and be influenced a lot, and we saw that in the previous presentation. But do those types of child welfare improvements lead to longer-term labor market impacts, longer-term productivity impacts? That has, there's some conflicting evidence there. In terms of agricultural investments, which make up an important part of the livelihoods in many of the world's rural poor, there's been an increase in evidence from the FAO in their protection to production project, and they've looked at cash transfers in a lot of different settings and tried to see how they have impacted productive investments. And there's been some mixed results. We see in a lot of countries some modest improvements, especially in increases in livestock and input purchases. But with respect to kind of large transformative impacts on people's livelihoods, the evidence has been a little bit more limited. We have some recent studies from IFPRI in Malawi and Senegal, and also a study in Mali that does also seem to indicate that cash transfers do have a potential to increase agricultural production and livestock capacity. However, most of these studies are occurring in a context of persistent poverty, and the question is, are these results going to hold in an emergency setting where you have instability and political uncertainty? We have witnessed over the last decade a huge shift from thinking about transfers from specifically food-based transfers to thinking about cash, and a large shift in resources to cash transfers, and they have been studied in several different contexts. Most of those contexts have dealt with the effects of each kind of transfer on consumption and expenditure, and here we're going to think about the impacts on productive investments. So one question might be, why should it matter whether you give someone $50 worth of food or $50 in cash? Why should this matter for agricultural impacts? And basic economic theory would suggest it doesn't matter. If the transfer is the same value, and if the transfers in for marginal, right, we shouldn't see any difference. But of course, we know that households face very complicated liquidity, credit, risk constraints. We understand the importance of seasonality, especially in agricultural investments. And so as a result, we might have some changes that could occur that could occur depending on the type of transfer that we see. Okay, so why might we want to see cash in a productive investment environment? Well, one reason is that there could be binding liquidity constraints to productive investment. So, meaning households, they just need some cash in order to make the investment. There's a profitable investment, it's waiting to be had, right? But, because of the setting that they're in, because of poverty, they don't have the cash actually available. If you're able to give a transfer in cash, they have the cash on hand, they can make the investment, right? And you can see the positive outcomes, right? That might be particularly, important because of these seasonal constraints. We understand that some households have low periods where they don't have a lot of liquidity, they don't have a lot of cash, right, due to the timing of sales of agricultural production. And so cash might be particularly attractive in that context. But why might food actually increase productive investments differentially than cash? Well, food transfers, and this is something that economists have thought about at least since the 90s and probably before, is that food transfers might allow households to self-insure their food crop production in a more effective way than cash, because it eliminates food price risk. If I have stocks of food in my household, I know that no matter what happens, if there's a political crisis, if there's conflict, right, worst comes to worst, I can consume that food. And so that might drive cropping decisions. It might drive households, right, facing uncertainty, to want to favor, right, producing food crops at a higher rates than normal, right, because they might be really wanting to make sure they avoid any food price risk, any risk of transferring, of trying to actually take their cash crops and obtain food with them, right? They can avoid that risk if they are growing food crops. And so the idea here is that if you transfer these households food, so if you alleviate that kind of risk, they might be more willing to make an investment in cash cropping, and that investment in cash cropping might be more profitable. So that's the basic economic framework. But the setting here is going to be the rural areas of two governorates in Yemen. That's Haja in the northwest and Ib in the center. Sorghum is going to be the most important food crop in this area, while Qat is the most important cash crop and the most profitable one. The data collection, as I mentioned, was from 2011 to 2012. So this is a very volatile time period, extremely volatile food prices here. We have localized violence, but this is prior to the onset of the full-scale war and the consequences that we're seeing now. So we have unconditional food and cash transfers, and whether households in a village get food or get cash is randomized, depending on the village they live in. The food distribution point, FDP, using the terminology of the World Food Program. Each group, the cash group and the food transfer group, gets essentially $50 worth of value of each transfer, and they each get 3 transfers each. The cash group getting the value of the transfer in cash, the food group getting 50 kgs of wheat flour and 5 liters of oil for each transfer. I'm going to put up the program timeline here, and the main takeaway from this is that we actually had quite a bit of trouble with the implementation to make sure that the timing of each transfer was aligned. And this is a common, I think, a challenge with doing these types of impact evaluations in crisis or emergency settings. So you have a lot of logistical challenges to kind of implementing the evaluation with the quality that you want. In the case of looking at productive investments, the type of differences that we might see from the differing of the transfer schedule might not be so important because the cropping season is lumpy, and both transfers occurred right after one cropping season and before the onset of the next one. The strategy and the methodology that we're going to be using is to essentially compare the 15 beneficiaries in each food or cash village to the 11 non-beneficiaries in the same village. And there's 3 basic ways we could go about actually comparing these effects. And in the major paper, which you can find on the UNICEF website, we actually do all 3. What I'm going to show you here is we're just going to look at what are the effects of the food transfer, what are the effects of the cash transfer. We're going to kind of compare them side by side. And the reason why we do that is because the takeaway from that kind of comparison is going to be the same as whether we ignore the non-beneficiaries, whether we do something, a more formal comparison. And as you'll see, it'll be kind of easy and nice to look at. So let's first look at what I alluded to before about the cash cropping impacts. So what you're seeing here is the red bars are going to correspond to the impacts of cash, and the blue bars are going to correspond to the impacts of food. So first on the left side, you're going to see is that in the cash group, you have a kind of small negative insignificant effect for cash beneficiaries on initiating cash cropping. The blue bar is showing you that for the food beneficiaries, they increase their cash cropping by 2 percentage points. The next set of results, you can see that are labeled cut, is showing you that all the cash cropping results are driven by what beneficiaries actually did with COP. Okay, so what we see is that the food beneficiaries are actually adopting COP production at higher rates due to the fact that they received the food transfer. You can see there's very little impacts on other cash cropping, and for cash beneficiaries, for wheat, for example, it's a negative effect. When we look at the impacts on livestock, we see a bit of an opposite story. The red bars, as you're going to see, are kind of higher and above 0 for almost every type of livestock, and I've only put 3 of them here, including a total livestock units at the end. The blue bars, for example, are 0, are going to be negative. So what we see is that we have the cash beneficiaries, right, investing in livestock. They're going to have more camels and donkeys, more poultry in particular, more sheep and goats not shown, and overall the total livestock units are increased by about the equivalent of a sheep or goat. What you can see from the fact that in the total livestock units we see almost 0 blue bar is that there's 0 impact of the food transfers on their livestock herds. When we look at farm investments and expenditures, we also see that the value of the type of assets and the value of the livestock that cash beneficiaries are accumulating have also increased, although the estimates are very imprecise. When we look at, for example, farm assets and debt expenditure, we see very little difference between cash and food. Both seem to increase the amount of small farm tools that each household has, but there's no really gap in the size of the difference. Labor estimates are similar. Both seem to increase actually off-farm labor work, but there's, again, not a huge difference in terms of the cash and food transfers, not a big difference in child labor. We don't see any kind of worrying impacts of the transfer. So just to summarize the results, right, what do we see? So we have a cash versus food program, And just as a side note, right, we've looked in other papers at looking at consumption. You might be wondering, well, what else besides cash cropping and livestock was happening? Well, we did see on the consumption side, we saw cash beneficiaries increasing their dietary diversity quite a bit, food beneficiaries increasing their calorie consumption. On the productive side, what we see is that we have a small increase in cash cropping for the food beneficiaries. That increase is almost exclusively in increases in cod production, which is the most profitable crop, although it's somewhat controversial. But we don't see any type of increase in cash cropping for cash beneficiaries. We see an increase in livestock holdings by cash beneficiaries. Relative to food, that's about an increase in a goat. And those results are consistent with both risk and liquidity constraints. So we talked in the beginning about why cash and food might differ in their impacts, right? Well, if for cash beneficiaries, if they're liquidity constrained in the sense that, so if all the population that's being served here, right, are facing both risk and liquidity constraints, if you're receiving cash, right, that's going to allow you to make investments in livestock that you wouldn't otherwise be able to do. If you're receiving food, right, we might have this risk story happening where, again, you're risk constrained and you're worried about your food stocks because you're not sure what's going to happen. Right? And so even though you might realize that cod production might be, in theory, more profitable, right, you're a little bit more worried about reducing some of the food crop production that you might have. And so receiving that food stock alleviates that risk somewhat, allows you to more comfortably be able to increase your cash cropping. The size of the impacts aren't huge, right? We talked about 1 goat, 2% increase in cash cropping, but they're not zero. So as I said, when we think about what's the definition of modest, for many people, the idea of receiving a transfer program in an emergency setting, any kind of productive impact is taken to be more than expected. For some people that are expecting, oh, these will have transformative impacts on livelihoods, perhaps the results from Yemen are slightly disappointing. Caveats, like Sarah, we have also some caveats from this study, right? When we think about liquidity constraints and investment, and we see these increases in livestock, right, we're not sure, are these really productive investments, or are people just saving, right, by saving their cash by buying livestock? We also might have some concerns with the regression to the mean because of the results on cod. Actually, cod production started a little bit lower in food transfer areas, so it's potential that these aren't actually results that are due to the food transfers. So just to wrap up, I'm going to just mention a few of the kind of larger implications and some of the kind of questions that are being raised and potential areas for future research. So how should we think about what productivity effects mean in the context of emergency aid, and how should they be measured? Because as we note here, right, we're going to have multiple constraints to productive impact. It's almost certainly going to be the case that the households are going to be facing, right, liquidity challenges, risk challenges, right? And so, right, if we want to think about what is the one key constraint that they face, it might be an elusive search because they're always going to have multiple. And so it might be difficult to predict a priori what is the best kind of feasible return on capital. And I think that's a kind of a very important lesson from finding that we have differential impacts from food and cash. In particular, I think the importance of thinking about expectations and risk during the crisis is also really important. And in particular, that we might see dynamic impacts. So like Sarah, we're talking about a very short-term evaluation, right? And how we should think about this over the long term might differ. in the future, when we think about what kind of ways in which we might be able to think about future impact evaluations and how that might be able to better inform some of the ways in which we operate during humanitarian crises. Some kind of, I think, important issues are to deal with the fact that we have very important issues of future expectations and risk, is making sure our evaluations understand from the beneficiary's perspective how they think about future expectations and how they think about how the transfers and social protection benefits they're receiving fit into that long-term strategy. And I think actually in many of the impact evaluations, right, we don't have a great idea of how that's happening. Other potentials are looking at mixing kind of demand-driven grant elements with humanitarian transfers. Right? And finally, one thing that I think is important to think about in humanitarian interventions, because as Sarah mentioned, right, we have limited budgets here, and we want to make sure that we spend the money in ways that will be of the most benefit to vulnerable populations, is thinking about, right, what is the actual counterfactual? Is it a group that's receiving nothing, a control group, or are we thinking about really thinking about actually just comparing different modalities of assistance, right? So how versus if. And so all these are things that if you want to follow up on, I'm happy to take questions. Thank you very much, and apologies if I went over time. I didn't have a clock in front of me.
Thank you very much, Benjamin, for your presentation. Now we move to James's, which will focus on the cases of Mali and Mauritania. I'd like to remind everyone who's joining us to please send your questions via the chat bar of your webinar application, because after James's presentation, we'll have a Q&A session with all panelists. James, over to you.
Okay, hello everybody. As already been said at the start, I am based at the sub-regional office in Dakar. We support the countries in West Africa and the Sahel. So the area where we work is really faced by a lot of challenges from climate challenges and also from different wars in the region. My presentation is on the findings of an impact analysis on an emergency cash intervention FAO implemented between 2015 and 2017 in Mali and Mauritania. This project was funded by the Finnish government under the title Productive Safety Nets as a Tool to Reinforce Resilience in the Sahel. Agriculture and livestock are the backbone of household livelihood systems and national economies in the Sahel. Most of agriculture in this region is rain-fed, hence the high sensitivity to seasonal rain, performance, and impact of climate change. I was still on the first slide, sorry. Yeah. So, millions of people here are food insecure, with even more reaching emergency thresholds and are requiring urgent food assistance. It is in this basis that this project was formulated. Slide 2, please. The main objectives of this project was to increase the resilience to shocks of vulnerable households in food insecure regions in Mali and Mauritania, and to extend the knowledge on the impact of cash plus approach and on resilience of very poor populations in Sahel. The beneficiaries of this project were selected through community-based targeting using a household economy approach criterion. Two modalities were selected. This was cash only, where specific amounts of cash were distributed to the beneficiaries, and the other one was cash plus, where cash was distributed in combination with dewormed livestock, animal feeds, plus offering of various training and technical support. At the end of the project, a total of 1,400 households were assisted. Next slide, please. Initially, the project targeted 1,250 households, of which 750 were in Mali and 500 were in Mauritania. Half of those were provided with 3 goats each, 1 male and 2 females, plus 50 kilograms of animal feeds and cash transfer of $35 in Mali and $56 in Mauritania. The other half received $160 in Mali and $270 in Mauritania. The project also included organization of trainings on nutrition education, where 74 people were trained in Mali, followed by a distribution of 36 culinary demonstration kits and 16 boxes of soap. There are also complementary trainings on good practices on livestock breeding, followed by missions to assess the conditions of the distributed animals. Technical trainings were also offered. They were aimed at helping the highly vulnerable, poor and food insecure households to boost their livelihoods and production capacity. At some point, 2 technical and animal health monitoring missions were organized. Thanks to the additional funds, the project was extended to reach additional 150 beneficiaries in Mali, where 75 of them received 4 goats and 300 kilograms of livestock feed, plus a cash transfer of $32. The other half received $160. In Mauritania, these additional funds were used to extend nutritional trainings to 500 beneficiaries and to treat 3,000 animals in the project intervention areas. Next slide, please. Okay. The project was implemented in close collaboration and partnership with government decentralized services, international NGOs, international and national NGOs, as well as the private sector, i.e. the microfinance institutions. In Mali, the technical services involved are the decentralized technical services of the government in charge of social development and solidarity-based economy, animal health and livestock production, 2 NGOs and a microfinance institution. In Mauritania, we worked with the Ministry of Agriculture and Livestock, a local NGO, and Action Against Hunger. Next slide, please. There was need to measure the impact of different combination of intervention on the resilience to shocks of households. This called for development of a sound M&E framework to assess the change between the situation before and at the end of the intervention. In this framework, a baseline survey was carried out in both countries before the start of activities. This provides critical information as a benchmark to compare with the project results. Throughout the project implementation, regular post-distribution monitoring was conducted in order to analyze the use of assistance provided, as well as the opinion of beneficiaries on the distribution process. This comprehensive process helped to better understand the impact and to monitor the progress of the project. At the end, a final evaluation of the food security and nutrition indicators of the project was conducted in both countries. This was necessary to compare project results with the baseline. The findings were as follows. Next slide, please. In Mali, an improvement of food security situation was noticed by approximately 20%, according to the Household Food Insecurity Access Scale and the Hunger Index. At the same time, approximately 24% of the children aged between 6 to 59 months increased the individual diet diversity score. This indicated a clear improvement of food and nutrition status of the project. The percentage of households not having enough food or money to buy food had decreased from 96.6% to 80.2%. The average income of beneficiaries increased, and their sources of income were diversified. For example, the percentage of households with income above $119 increased from 17.5 to 40.5%. Next slide, please. In Mauritania, the project contributed to improving the household average monthly income by 29%, from $65 at the baseline survey to $84 endline. Furthermore, improvements were noticed in food access as the average number of household daily meals increased from 2.01 to 2.1 meals a day. Coping strategy index, as there was a clear reduction of adopting negative coping strategies like skipping meals. The household food consumption score increased as 93.4% of the households had an acceptable food consumption score against the previous 66% at the survey. A significant increase of number of livestock owned by the household was noticed. This was an average of 2.5 goats at baseline to 4.58 at the end line. Next slide, please. At the end of the project, a final regional workshop was organized in Dakar to capitalize on the results of the project and to exchange on the lessons learned. This brought together the beneficiary countries, Mauritania and Mali, and also the FAO sub-regional office. The workshop focused on three main issues. The technical aspects, where discussions were around targeting communities and beneficiaries, the contents and the process of implementation of the activities, the impact of the inputs provided, the follow-up of activities, and sustainability and exit strategies. The operational aspects where partnership, the inputs and purchases, visibility, and operational management were discussed. And then there was the analysis of the food security and nutrition indicators that were measured throughout the baseline, PDM, and market analysis and endline. On top of that, the project provided an opportunity for a cash plus scale up study, not only in Mali and Mauritania, but also in Burkina Faso, the Niger, Senegal, and Chad. This study intended to submit its recommendation on how to scale up the cash plus approach and to link it to the social protection, agriculture, food security, nutrition, and resilience. I have put some links at the bottom on this slide on the material communication material that were produced during the implementation, in case somebody wants to check. Next slide, please. So I go to lessons learned. During the implementation of this project, there were successes and constraints. Successes included the combination of different kits in the cash plus were appropriate to the specific needs of the communities. Timely distribution was essential in order to protect beneficiaries' assets. It was found that beneficiaries received the kits before the lean season, and that allowed them to be more prepared in case they faced the shocks and to avoid negative coping strategies. Excuse me. Just a second. I don't know. Thank you. Okay. It was crucial to sensitize and train on nutrition and key health family practices to avoid disease for children under 5. This sensitization on nutrition and essential family practice was developed as a result of an impact study carried out for the previous pilot project in Burkina Faso and Niger. Project activities had strong impact on women, especially on their economic empowerment and consequently on their decision-making positions within the community. The local mechanism of solidarity was respected through the targeting methodology that used a combination of community-based approach involving women and youth taking into account the result from the household economy approach. A good baseline study involving the relevant national partner was essential to determine the impact of the project on the beneficiary household. Regular feedback from beneficiaries through focus group discussions PDM was important to inform and to redirect the project. In terms of challenges, I can say in Mali, the inaccessibility of roads during the rainy season and the transhumance, that is displacement of people, slowed down the activities. To solve this, some activities had to be rescheduled, and the municipal communities ensure the follow-up of the beneficiaries and the transmission of information to the implementing partners. The presence of predators like jackal and snake and the absence of proper monitoring of health of the distributed animals resulted in mortalities in some cases. To solve this, the project team initiated the zoo technical and animal health monitoring missions. There are cases of theft, and to improve this monitoring mechanism at community level were developed. There are lack of means of travel and turnover of staff in the decentralized offices of the government. So to solve this, some NGO partners stepped in to assist the technical services in the implementation of the activities. In Mauritania, among the obstacles, the monitoring and evaluation system did not work well, as it was not fully assigned to a team member. The project management team assigned a person to do it at needs basis, as was needed. Local NGOs were first contacted to conduct follow-up surveys, and this resulted in less control of the data by the team. There are difficulties around targeting activity regarding exclusion and inclusion errors. A group of poor households were absent during targeting, and at the distribution time, they claimed their right to be among the beneficiaries. In order to mitigate this obstacle, the communication campaign was run through the local authorities to better sensitize the population. On the other hand, the team also noticed that a few occasions, persons with means in the villages received the cash plus kit. At the regional level, there was lack of communication between country teams. The final workshop showed that it was essential to organize regular face-to-face meetings between the beneficiary countries by doing alternating visits to the countries. When needed, the nexus between the countries could provide pragmatic solution to difficulties. Next slide, please. A recommendation, sorry. So it was agreed to continue monitoring the impact through the surveys, and this was after 1 year, 2 years, and even more. The study was supposed to be finalized on the study on the scaling up was supposed to be finalized. It was also development of concept notes for scale up and promotion of inclusion into policy and food and nutrition security programs, workshops and communications campaigns to be organized. And then there was need for establishment of partnership with other agencies. Next slide, please. So FARM continues to promote Cash Plus approach as a tool to emergency response, strengthening resilience and reducing poverty. Right now, it has really been strengthened by involving different integrated approaches like case de resilience, Club de Maire, for example. Cash Plus approach supports the enhancement of vibrant and diversified livelihoods and provision of important safety nets to shocks. It is a tool to quick impact humanitarian response and recovery, as well as serving as a component of long-term social protection and resilience. FAO's work on Cash Plus is based on experience and research showing its potential to sustainably enhance the economic and social impacts of cash transfers and when combined with productive support and training. Next slide. And thank you. That was the end of my presentation.
Thank you very much, James. So now we begin our question and answer session. So firstly, there was a question that was addressed to Sarah, but actually I think it can be replied to by all the presenters. So the attendee asked, how can you improve the transfer of knowledge to national entities? So national authorities and national entities related to social protection, strengthening rather the local capacity to eventually support the national governments in working to absorb or even some assistance to these people that receive humanitarian assistance. So in the case of Lebanon, the refugees. But I think it's a question that can be addressed to all presenters if they have any insights related to this transfer of knowledge to the national entities. Another question directed to Sarah was regarding how did the study consider the assistance that was other assistance that was provided through the system Louise? So rather about the coordination of different programs that were provided through this system. And another question is regarding child labor and child marriage. So these sensitive issues and how the parents and guardians have a role to play in this decision. So how did the impact evaluation handle these more sensitive issues? And another question here, also for Sarah, is regarding social cohesion. So how did the program seek to address social cohesion and how did it impact this aspect? For Ben, I actually like to ask also about regarding the different modalities of transfer. So how did inflation have a role to play in the evaluation, and whether beneficiaries' preferences for one rather than for cash or for food were considered before implementation or during the evaluation? So we can begin with this round of questions, so let's begin with Sarah first, then Ben, and then James.
Okay, thank you. So yeah, so in terms of that question about that Elena asked about whether we were taking into consideration the fact that some households were receiving other assistance from other places, we didn't look at the difference between the different types of benefits that people were receiving, because households were receiving all kinds of different programs, including cash programs from other UN agencies and other types of programs. But what we did is make sure that the treatment and the control groups were statistically almost identical. So we could be sure that the impact of the Manila program was captured in our impact assessment. So I think the majority of the programs in the UNICEF program were also receiving some other kind of cash support. And as I said, when we designed the impact evaluation, we wanted to make sure that we really captured the impact of Manila and not the impact of other programs. In relation to the question about child labor and child marriage, maybe I'll answer that as well. I mean, they're very different issues, and of course we agree very much that parents and also communities have a very strong role in these issues. But child labor, I mean, of course it does have a strong economic and poverty factor to it. It's very much driven in many cases by the poverty of households and the situation that they find themselves in. And we have to be careful how we respond to that. We don't want to be designing a program that provides cash transfers if children are in child labor, for example, because that might create perverse incentives. And for child marriage, I mean, that's clearly not something that can be dealt with sufficiently through cash transfers, which is why going forward, we only want to have a program which is going to be truly integrated into other sectors and other programs. So in that case, these households that will be receiving the social assistance will also be receiving child protection services. They will be able to be referred through case management for a range of different issues. At the same time, we'll be also designing a component around social and behavioral change and communication change to support the households and the communities in their thinking around these issues. And yes, the national system is very much involved. This is very crucial to make sure that if it's linked to schooling, that the Ministry of Education in the Manila program was very much involved. There are a couple of other questions, but maybe a couple of other people want to answer something. Maybe Ben, you wanted to answer that question to you.
Sure, thank you very much. There are two very specific questions about the Yemen project. One was about inflation, one about preferences. I'll start with the preferences question first. So there was no consideration prior to the design about beneficiary preferences for either cash or food. We did ask people whether they would want their transfer in cash or in food during the project. And in the baseline, we started off with kind of a mix. And at the end line, high preferences for cash. Now, one question that's always difficult to kind of sort out with these issues is how much were those preferences driven by just different implementation issues, right? Because it's hard to separate out. In theory, would somebody have wanted the cash or the food if it had been delivered at the exact day they said it was to be delivered? And so the food delivery had more implementation challenges. So whether the preference for cash was driven by an inherent desire for having the transfer in cash, or whether it was about the fact that the cash was more reliably delivered on time, it's hard to separate that. It's a really good question. And so is the inflation question. The timing of the survey was pretty short, and actually, even though food prices were extraordinarily volatile right before and right after, there was, I guess, a bit of luck during the sense that even though the transfers weren't indexed to inflation, the food prices didn't actually change all that much. So the purchasing power of the cash and food remained fairly constant. It actually increased somewhat. But I do think the idea of the potential of food prices rising actually did explain some of the differences that we may have found. I think actually the idea that in the future, right, I'm not sure what food prices are going to be tomorrow, and so right, this having if you're receiving cash, right, you know your ability to use that cash to purchase food might degrade at any time, and so your willingness, for example, to adopt cash cropping might be less than if you had received food. And I think actually that was important to play a role. I'll just mention one thing quickly related to the questions that Sarah was discussing about child marriage, because obviously it's an issue in Yemen as well. We did actually attempt to collect some data on this issue, thinking about whether the transfers were changing some of the marriage market issues going on. And we struggled a bit to do it in a way that would collect reliable data and also not endanger other parts of the data collection. It certainly was a topic that was sensitive, and even though we worked with our local partners really hard on thinking of good questions to ask about just beginning of marriage negotiations, we didn't find that we were really able to use that data in a reliable way. So I think it's a really actually important issue, and one that we probably need to think about, even just beyond in the context of impact evaluations, just about the different methodologies involved in the data collection.
James, if you'd like to address any of these points.
Yes, on the beneficiary preferences, I would say for Mauritania, I think it was discussed with the beneficiaries because the interventions were in different locations, and there are locations where they preferred to have cash alone, and then there are locations where the majority preferred the combination. So it was according to the beneficiary preferences. And I think there was a question I didn't get right on the partners, I think. If maybe you could repeat.
I had a first question for all of you. So if you have any insights as well on regarding the transfer of knowledge to national entities. So national institutions working with social protection, how is this being planned in the program, in FAO's program?
Normally, we work closely with different stakeholders like government and also private sector. And so we sometimes make regional or national workshops where we invite both government and the private sector. Anybody who is part, that includes the partners that we work with. So when we organize workshops, we invite different participants and share the knowledge with them.
Okay, thank you. So now we have two final questions here for all of you. So how do we ensure, I'm reading this out, so how do we ensure the levels of sustainability are enhanced, so sustainability of interventions, I'm assuming, in the wake of humanitarian fatigue? And also another question is regarding some quantitative aspects that are difficult to measure. So I'm gonna read this out. Am I correct to hear a strong emphasis on increased related change, whether increase in investments or returns in use? Is this not missing other changes that are not quantitative? Vulnerable households in crisis often end up spending from borrowing, bartering, selling of their assets or labor, which can be very stressful and shaming. Quantitatively, after a cash transfer, there might be no change in spending, which will be recorded, but a qualitative change will be significant. The assets saved will not be accounted for instance, or other aspects. So a little bit, I think this is not addressed to anybody in particular, so all panelists can share their insights. And then there is a final question that is directed specifically to Sarah. So is UNICEF in Lebanon investing to strengthen the national social protection system and its shock responsiveness? And how is it doing this, if so? So Sarah, we can repeat the order again, Sarah, then Ben, and then James.
Yeah, sure. So let me start at the end. So that point on supporting the national system, yes, absolutely. As I mentioned, for the last year or so, we're now providing the technical support to the government to actually put in place a national social protection system, which is going to be a very long-term job. There is no social protection policy in Lebanon. There is no legislation whatsoever for the social protection sector. It's also the only country in the Middle East region to not have a national cash transfer in place. So someone was asking a question about tensions and community tensions. So refugee families can get cash transfers, but national households, Lebanese households generally cannot. So we're supporting that process, and it's well underway, but it is quite a complicated process in the country. And we're also in a time of very difficult economic and fiscal situations. So we're trying to see also how to engage in that and make sure that any negative impacts are felt least by the poorest people, and that economic growth can be more equitable and shared more with the poorest. In terms of the question about qualitative impacts, I think Alfred was asking, I think it's very important, and I think that was illustrated by my points about that we can use qualitative analysis much better. And in our impact evaluation, we had sort of the quantitative alongside the qualitative. And I think we need to get better at integrating the two and using the qualitative analysis to delve into some of these findings. For example, we found, as I said, that teachers and households would talk about how the Manila program increased their dignity and help them to feel more equal to others around them, and to reduce some of the shame that they felt of being unable to buy, basic equipment or to put their children on the bus in the morning to actually go to school. So those impacts are very important, and as researchers we all need to make sure that we think about how to integrate the qualitative and the quantitative and give them equal weight when we're thinking about the impacts of our programs.
Right. So I quite like that last set of questions because they're all very much related. When we think about the sustainability impacts and how evidence bases should kind of inform national institutions, I think it goes back to some of the same concepts that we discussed in terms of humanitarian programs themselves and the multiple constraints that households feel. I think at the national level, there's heterogeneity in terms of what information is important to national institutions, and is there a difference that information alone can make, and is there going to be aspects that are going to be kind of beyond what the evidence base is, and understanding, what is the demand from information from the host government, what actually is it that is important that they should know, and it might not be the same for each government. And I think that the reason why I think that relates to some of the question about that Sarah was just talking about the qualitative impact and understanding those issues, the example that was given about people spending down their assets and that might not be seen, that's something that with the right design, with the right counterfactual, you can actually see that, oh, your beneficiaries, their asset level stayed the same, but non-beneficiaries, for example, we see them drawing down their assets. But I think actually it goes back to thinking about what is in our valuations, what is the counterfactual that we want to measure. Do we want to think about the idea of just saying what happens if you don't give something versus if you do, or do we want to spend our energy on evaluating and comparing two different modes of assistance, in which case what you give up from doing that might be a better ability to pick up some subtleties of having any kind of assistance, versus and that might be very useful to know that, because it's useful for informing national governments about whether programs should sustain, whether they should continue, why they're so important, versus whether we think, no, we know that, right, here we're in a situation where we know the marginal value of assistance is so high. We have a humanitarian setting. Should we focus on the fact that, are these doing any good, versus what exactly these interventions are doing that's useful, and how can we compare the most effective way of delivering them? So I think those are really kind of fundamental to questions and to deal with, and so I appreciate you letting me participate in the webinar.
Thank you, Ben. So James, your final thoughts?
Okay, I'll respond to the question on sustainability. FAO does not only support the governments in developing social protection policies, but it works closely with them to strengthen the already existing social protection systems in the countries. And it also tries to link its activities to the existing social protection systems. And this ensures continuation even after the project has ended. Thank you.
Thank you very much. So that is it for us. I'd like to thank the panelists, Sarah, Benjamin, and James, for the excellent presentations and insights, and thank everybody who joined us today. and let you know the presentations, the slides, and the video recording of this webinar will be available, and you'll receive a message soon after this webinar. So thank you everyone, and have a great day.